Good morning, good afternoon, and good evening to all of our esteemed participants joining us today from different corners of the globe. I'm Mike Lamberson, and on behalf of NextEvo, it's my pleasure to welcome you to today's webinar, focusing on the scientific overview and recent developments in CBD for pain and inflammation management. Today, we are privileged to have a distinguished guest speaker, Dr. David Chernoff, an eminent expert in rheumatology who has been at the forefront of studying new and novel solutions to aid his field. Dr. Chernoff will be sharing invaluable insights and research findings regarding the utilization of CBD in managing pain and inflammation. Before we commence, a few housekeeping notes. Your microphones are currently muted throughout the duration of the webinar to minimize background noise. However, don't hesitate to jot down your questions in the chat box as the presentation unfolds. Without further ado, I'd like to extend a warm welcome to Dr. Chernoff. Thank you for joining us today, Dr. Chernoff. The floor is yours.
Thank you very much. I'm very happy to talk to you about cannabidiol and its use in pain and inflammatory states. Just a little bit about me. I'm a UCSF trained physician. I did multiple fellowships there, and I've had the opportunity to be the chief medical officer for some nutrition companies, including Schiff Nutrition, which is now part of Reckitt, and OLLY Nutrition, which is part of Unilever, and I currently serve as the Chief Medical Officer for NextEvo. So what I'd like to review with you today are several aspects about the metabolism, the impact of cannabidiol on various states, including inflammatory states. And so let's go through each section and talk about what cannabinoids are and what are the receptors referred to as the endocannabinoid system. So just a couple of basic terms. Cannabidiol is a non-hallucinogenic part of the cannabis plant. There are many related cannabinoids without psychogenic activity, including CBD, CBN, CBG, and there are many hundreds of these that have been isolated, but most of the scientific work has been focused on cannabidiol. Now, this is must be distinguished and separated from tetrahydrocannabinol, which is THC, which is the active psychoactive component of marijuana, and that's responsible for the high. So these are both in the same plant, but separated. One has psychoactive activity, the THC, the other one doesn't. And we're going to be talking about cannabidiol, the non-psychoactive cannabinoid. And you can see that these active molecules have very specific receptors on neurons and other parts of the body. And they are separated into two, CBD1 and CBD2. We're going to talk about the differences in a second. So here's the structure of cannabidiol. Again, it has very weak affinity for the CBD1 and CBD2 receptors. And because it really has very little interaction with CBD1, which is the one that's activated by THC, it does not have any psychoactive activity, as opposed to THC on the right, which is responsible for the high as well as other properties of that moiety. So it turns out that throughout the body and the nervous system, the GI tract, and other parts of the body, there are cannabinoid receptors in which cannabidiol interacts. It's part of a physiologic or homeostatic system that maintains a certain balance or set point for the immune system and the nervous system. And obviously the name CBD is named after the derivatives from the cannabis plant, and the endocannabinoid system helps regulate things like sleep, immune system functioning, and pain. And these receptors can be activated by a variety of what we call agonists, things that bind to the receptor and activate the system downstream. Those include the endocannabinoids themselves, plant cannabidiols or plant cannabinoids, so things derived from the cannabis plant, and then synthetic cannabinoids. We're going to be talking about plant-derived cannabidiol. And again, there are two different receptors, CB1 and CB2. So what do these receptors do actually? They are referred to as endocannabinoid receptors. They have various agonists, including things like T2AG and anandamide, which are very active compounds that interact with these receptors. There are very specific enzymes that metabolize them, including this fatty acid hydrolase and other related lipases. These are known as G protein receptors. There's a very specific type of receptor on the cell surface. They also activate what are called vanilloid receptors, which are very important in the mediation of pain signals. So when we look at the distribution of the receptors, and this is important in understanding the potential therapeutic implications of using them, you see that in the brain, there are receptors throughout, from the top to the bottom of the brain, from the cortex to the medulla to the hypothalamus, brainstem. And in the periphery, we have these receptors distributed throughout the body, spinal cord, and other organs within the body. So let's now talk about the potential use of cannabinoids as therapeutic agents, something that we would use to alleviate pain, reduce inflammation, increase sleep, etc. So again, there's a lot of published literature that goes back multiple decades that CBD itself, cannabidiol, has analgesic or anti-pain activity, anti-inflammatory activity, which is linked, has anticonvulsant activity and antispasmodic. And in fact, there is a FDA-approved drug, Epidiolex, which is a high-dose purified CBD, which is used in kids with pediatric refractory epilepsy syndromes. Now, we're not making an approved drug under FDA guidance because this is a supplement, but it's important to understand that the therapeutic activity of CBD has been exploited by the pharmaceutical companies in the context of epilepsy research. So, so how might CBD work as an analgesic, something that reduces pain and inflammation? Again, there are very specific receptors on nerve cells and immune cells, these G protein receptors. CBD also interacts with serotonergic receptors. Serotonin is a very important neurotransmitter. It's something that is acted on by antidepressant drugs like Prozac. And CBD effects on these receptors mediate the anti-inflammatory properties. And we now know one of the mechanisms by which it does that, and that's through a series of enzymes that are involved with the generation of pro-inflammatory cytokines and mediators. So there's been a very, very interesting and exciting new paper that was recently published, which gets into the molecular details of this, about why cannabidiol acts as an anti-inflammatory. And just briefly reviewing this, from cannabis plant, CBD itself appears to interact with an enzyme called 5-lipoxygenase on the surface of cells. And because it modulates the activity of that enzyme is involved with metabolizing fatty acids, including omega-3 fatty acids like fish oils, and converting them into very, very active lipids that impact the activity of human cells, including macrophages, and has a very potent anti-inflammatory effect. So this is one new mechanism by which cannabidiol may mediate inflammatory reactions and reduce inflammation, similar to what might be seen using a more classic drug, non-steroidal like Motrin or Naproxen, which is a cyclooxygenase drug. Now, so that's, in animal models of inflammation and pain. What about in humans? There have been some studies done, not definitive, but interesting proof of concept studies. And here the setting is post-operative, in which patients underwent arthroscopic shoulder repair, typically for rotator cuff injuries. They were typically, after such a surgery, they get either nonsteroidals or opiates, low potency opiates. Here they received a certain formulation, a special formulation of CBD. And what they found was there was less narcotic use in the group that was offered the active CBD, suggesting that its anti-inflammatory and its anti-pain effects reduce the need for using things like codeine, Tylenol with codeine, et cetera, in a post-operative setting. So this is an interesting preliminary finding that needs to be corroborated in larger studies. So let's switch now to bioavailability. And the reason I'd like to focus on that is that if you don't absorb a drug or a compound like CBD, it can't really have any therapeutic properties. So why are we concerned about this? Well, it turns out that CBD itself, in its natural form, extracted from the plant, is very lipophilic. It means it likes to be in a fatty environment with other lipids, and it's very poorly absorbed in humans if you use traditional oil-based formulations like tinctures. And so these are widely available commercially with OTC products that are nutraceuticals. And for the most part, there's very, very little absorption, less than 10% for these oil-based formulations, which include CBD, purified CBD, as well as isolate, which has CBD and related cannabinoids in it. And once you take these formulations into the stomach, it goes through the stomach into the small bowel, and then it is taken into the liver, where it's extensively metabolized, which is the normal process for oral absorption. And these metabolites are then excreted in the urine. Now, if you absorb very, very little, there's not much to metabolize, there's not much to excrete, so you won't have really an option to have a therapeutic effect. So it turns out that the way you formulate CBD, the formulation itself, is really critical in terms of absorbing the drug and having it have some effect on things like pain or inflammation. So if you have very little absorption, it doesn't matter how much you take, get very little into the body and very unlikely to have any kind of therapeutic benefit. So what do you do about that? So it turns out that in order to get much better bioavailability, and therefore the ability to impact a thing like sleep or pain or inflammation, you need to make a special formulation. And these special formulations may bypass the liver by going into the lymphatic system, reducing the extensive liver metabolism, which is the way the body is designed to get rid of things that it may not want. And so it turns out that in preclinical studies using a variety of formulations that are optimized for better absorption, we find that CBD can impact the immune system and decrease certain pro-inflammatory cytokines like IL-1 and IL-17 and TNF. And dose ranging studies suggest that if you give higher doses, you may have a better impact. So again, in the cartoon on the right, taking in the right formulation to take into account first pass metabolism to the liver, lymphatic absorption, so that you have enough in the system to have an effect. And so how do you do that? So, we know that the molecule likes to be in fat, but it's very poorly bioavailability. So you have low absorption in traditional or tinctures and oil-based formulations. But if you use certain tricks that have been learned from chemists and pharmacokinetic experts, you can change the formulation so that it's soluble in water. And the solubility in water and the tricks that are done to make that end up allowing for much higher bioavailability, higher levels when taken orally, and therefore higher systemic levels, and therefore a much greater chance of impacting a process like inflammation. And so you see on the right the kinds of effects you can have with various formulations that have been optimized to get to a water or aqueous formulation. And some of them, like in blue, have very much better bioavailability. So very large increase in the concentration in the blood when you compare it to some other formulations which have not been optimized for peak absorption. So we can use these types of tricks to make CBD more bioavailable in a special water-based emulsion or water-based formulation, which allows for increased absorption. Now, it also turns out that there's some tricks of nature that we can capitalize on, which is the food effect. And the food effect basically says if you take something fasting and look at its bioavailability, its absorption, and then you compare it to when you take it when you're eating with food, that difference in concentrations is referred to as the food effect. And in this case, if you take water-based formulations which have been optimized for better absorption, and you give it with food, you boost the effect. And so it's almost like a multiplier. So you can see on the right, on the left curve, to the left, you see the effect of just fasting. You have a peak and then it goes down rather rapidly. And to the right curve, which is the higher curve in dots, in the dotted line, is the same formulation given when somebody's eating a meal, which then has a further boosting effect. So you can use this when you optimize a formulation to further increase its bioavailability by just giving it with a meal. So just to summarize, variations in emulsion formulations really impact the bioavailability and the differences in formulations. And it's quite important to know what you're taking, whether it's been optimized for bioavailability. And it turns out that some of these new water-based formulations taken with food give the best bioavailability. And that may be 3 to 4 times the amount in a non-optimized formulation taken in a fasted state. So let's now look using these optimized formulation as to what they might do in terms of dosing and the impact on various physiologic systems. Here's a study that's been conducted looking with a special water-based formulation, an aqueous formulation of CBD given at 2 different doses, either 30 milligrams given twice a day for 60 total, or 120 milligrams given twice a day for a total of 240 milligrams per day. In healthy volunteers, this is called a PK/PD study, a pharmacokinetic study, how much is absorbed. Pharmacodynamic refers to the impact on biomarkers like immune biomarkers, et cetera. So these healthy volunteer studies are done to look at the interaction between absorption and the effect on things like the immune system in a PK/PD study. They're also done to evaluate the safety. We look at the effects on blood chemistries. We look at the effects on blood pressure and heart rate and respiration to make sure, just like you would do in a formal drug study under FDA guidance, we use that type of rigor to evaluate these newer, better optimized formulations. And what you can see in this slide is that in green at the lower dose, you get some absorption of CBD. And when you increase the dose, and this is called dose responsiveness or dose linearity, you have a marked increase. So you see that the higher the dose administered, the better the absorption and the better the PK. So you can see that on the right as a function of time, after a period of about 180 minutes, you start to see the absorption go up, and there's a dose response, which is what you'd like to see, that the more you give, the better the absorption and the concentrations are. So, in that particular experiment in healthy volunteers that was conducted, we also looked at the impact, the pharmacodynamic effects of the CBD and the special formulation on immune biomarkers to see, could this be impacting something like an inflammatory state or a pain state. And what you see on the left are the receptors that are on cells, and depending on the concentration of CBD that they're exposed to, you have an impact on the ability of these cells to release cytokines. And what we see on the right, and the top shows you different cytokines like interferon gamma, interleukin 6, and TNF alpha, that depending on the dose, you can modulate, either up or down regulate certain cytokines, which suggests that at these concentrations, we have the ability to influence the working of the immune system, and we can use that to our advantage in an inflammatory state where there's too many pro-inflammatory cytokines, using optimized CBD formulations to work sort of like an anti-inflammatory, like a non-steroidal, but not have the same risks of things like bleeding or renal dysfunction, which are known side effects of anti-inflammatory drugs like Motrin and Naprosyn. And we do see in this slide, depending on the cytokine evaluated, that seems to be a dose response. The lower and higher doses have different impacts on the cytokines of interest. This is a preliminary study in healthy volunteers who don't have any active inflammation, but it's suggestive that based on the levels that are achieved with this optimized water-based formulation, you have the ability to influence immune responses. So, I'm a rheumatologist by training at UCSF, so I'm very interested in inflammation and joint disease. I've worked for many years in my career working on this area, and there's some very interesting potential applications of the use of CBD in the context of an autoimmune disease like rheumatoid arthritis. And it turns out that the difference between a rheumatoid joint and a healthy joint is very significant. A rheumatoid joint has very many pro-inflammatory cells secreting pro-inflammatory cytokines, resulting in a lot of joint destruction, inflammation, edema, destruction of cartilage, and tissues surrounding it. And so it's a form of inflammation that never resolves. It's different than having an acute injury to the knee, let's say falling or getting hit on the knee. You have swelling and then it resolves and you get better. In rheumatoid arthritis, you have this chronic non-resolving inflammation. And based on some of the research, some of which we just talked about earlier, cannabidiol, from multiple studies that have been done by independent research groups, has very interesting impact on a lot of the different cells that are responsible for the pathophysiology of RA, including T cells, B cells that make antibodies, monocytes that are professional sort of cells that eat and clear debris and are involved with resistance to infection, as well as the synovial fibroblasts, which lines the joint itself. CBD has the ability to modulate the activity of all of these cells in preclinical studies, suggesting that they might be useful in the context of treatment for rheumatoid disease and related diseases. And a study that was published last year looked at CBD's impact on a whole variety of chemokines and cytokines that are upregulated in the context of rheumatoid arthritis. And they showed that CBD enhanced the drug uptake by B cells and synovial fibroblasts. CBD also reduced or enhanced pro-inflammatory cytokines depending on the activation state of those cells. Very interestingly, in the model that's used by all pharmaceutical companies to evaluate whether or not a drug might work in rheumatoid patients, you induce a rheumatoid-like disease in rodents like mice. It looks just like human RA. You test your drug in that system, and many of the approved drugs have a lot of potent activity in those models. And CBD has a very potent drug-like effect in the experimental arthritis model, which is very, very exciting and promising. So its potential to use, provided you have significant absorption based on the formulation used, it may be important in studies going forward to look at this as a novel anti-inflammatory drug. So what about the safety? Because, it is a drug in the sense that we're taking something that's been isolated, giving it to people in its pure form. And it turns out that CBD, given at these concentrations, one, it doesn't have any influence on food intake. There's no increasing appetite that you see with THC and related psychoactive compounds. It doesn't affect your heart rate, doesn't affect your blood pressure, your temperature. People and very high concentrations have been given, doesn't have any effect on the enzymes that are related to platelets and inflammation. So it seems to be very safe. And in the study that I referred to earlier that was done by NextEvo, it's been shown that CBD formulation that's been optimized for bioavailability had no real toxicity in healthy volunteers, no serious adverse events, very minor adverse events related to some fatigue and some nausea, and there was no impact on liver tests, on liver function tests, which is an important safety consideration. So I'd like to conclude with CBD itself may be appropriate for complementary administration in acute or chronic inflammatory diseases that we reviewed, including things like rheumatoid arthritis. It's very important to have the proper CBD formulation because of the poor bioavailability of the parent molecule and the right dosage in order to get some sort of a therapeutic effect. And it looks like from human studies that have been conducted, short-term CBD use, even at high doses exceeding 1 gram per day, does not appear to have any acute safety concerns or adverse events. So, what we do with these types of formulations in CBD is trying to look at taking something that's been optimized so that you have the best absorption possible, giving it with a consistent dose and analysis that there's actually no THC in the formulation. This is a quality issue, and that's not true for many commercially available CBD options, which do not go through the same sort of safety rigor and evaluation compared to some things that we're talking about today. There's been a lot of research done by multiple groups looking at the potential for CBD to act as a therapeutic in inflammation and pain and sleep and anxiety. And we've shown in some of the studies I just reviewed the potential to impact the immune system. Many of these optimized formulations can be given as pills, as gummies, as water-soluble sachets. So there's optionality in terms of how it's actually taken. So we really are trying to develop a better CBD based on rigorous science, human studies, preclinical studies, offering it in various concentrations and various formulations so that the potential for CBD as a therapeutic can be achieved. And I want to thank you for your attention. I hope that this session has been informative.
So with that, let's continue to the Q&A session. So I'll start with the first question. And the first question is, do you have any thoughts on other cannabinoids to treat inflammatory disorders other than CBD? Because I know a lot of the presentation was based on CBD, but are there other ones that have been studied?
Although there are many hundreds of related isolates that are chemically related to CBD, cannabidiol, like CBG and CBN, there isn't a lot of published research on these alternatives. So the majority of the research that I was talking about is unique to cannabidiol itself.
Great. Okay. No, that makes sense. Another question is around bioavailability. So that was really interesting comment. And since that is so important, I would say this novel formulation, this water formulation that you were talking about, how does that compare to like other commercially available CBD products that the public can get.
Yeah, and so again, how does the absorption of this, the one I was just talking about, which has been optimized with an aqueous formulation compared to others? Now, the studies that I showed you were not head-to-head, but there have been multiple published studies by independent groups looking at a very similar formulation to the one that we've used compared to multiple other formulations where it has markedly increased 4 or 5 times greater bioavailability. The issue with commercially available formulations is, for the most part, none of these companies have done the kind of research that we just reviewed. So you really have no idea on how bioavailable. And when you look at the formulation itself, it may be a tincture, it may be a non-optimized formulation. So unless you've done this type of research that we were talking about, you really don't know what the pharmacokinetics will be.
Okay, great. Thank you for that. Question 3, what drug interactions would I have to be aware of using NextEvo CBD with my patients?
Yeah, very good question about drug-drug interactions. It's a really important question because CBD itself is metabolized through the liver through a series of enzymes called P450 isoforms, like 3A4. This is very typical for drugs and compounds. And in the presence of CBD and its interaction with liver tests of these enzymes and other drugs, which are also metabolized, there is the potential for a drug interaction where the other drug might be slowed down by the presence of CBD. However, at the concentrations that we're talking about, which is well under a gram, the potential drug-drug interactions are really minimal. But when you start to take large doses, like are given for epilepsy, then there has to be a concern. I think in general, anyone who gives a patient a supplement needs to be aware of the metabolic pathway, because many patients are taking statins and they have blood pressure medicines, et cetera. But for the kinds of concentrations we're talking about in this presentation, the potential for a toxic drug-drug interaction is quite small.
Okay, thank you. And this next question is kind of related to that. So what would I say to patients that say they smoke marijuana, so they already get CBD, they already get the CBD benefits?
Yeah.
Is that a true statement?
Well, I mean, it's partially true because THC, unless you're taking an isolate, just THC in a gummy or some other oral form, when you're smoking marijuana, you're getting THC and you're getting a lot of other cannabinoids. The issue is how much are you getting? Because they're not measuring CBD itself. Do you want the psychogenic activity, which is part of getting high? So we really want to focus on things that people can take that are not going to alter their consciousness or central nervous system. And we want to use those parts of the marijuana plant, like purified CBD, for its anti-inflammatory, its analgesic, its sleep properties, devoid of psychoactive activity, which is important that they're separated. So yes, you will get some CBD when you're smoking marijuana. The issue is how much, and we can't predict that.
That makes sense. I'm grouping, there's 3 questions that are all related to your background and inflammation and managing inflammation. So this question is around the biomarker chart. So that was a really interesting chart. It looked like there was a percentage change in cytokine levels, although I couldn't see exactly what was on the y-axis there. But it looks like there's an increase. Has this been shown in other studies or just this study that was run here?
Yeah, first I want to just comment on my background and expertise is in biomarkers of inflammation. And the kinds of tests that we use, when I just showed you, include very sensitive assays that directly measure these molecules. But in addition, like the thing I showed you was called ex vivo stimulation, where you take a patient's blood. These are not patients, these are healthy volunteers, so they don't have any inflammation. You put their blood into a tube, and in that tube, you have a stimulant that we call endotoxin. It's derived from bacteria. And the white blood cells react to that as if there's bacteria there, and they get very activated and they secrete pro-inflammatory cytokines. So it's a way for us to simulate what those cells might do, because we can't purposely infect the person. And those ex vivo endotoxin challenge experiments show that depending on the cytokine, you may reduce it in a percent reduction compared to baseline. That would be the anti-inflammatory effect. There are also cytokines like IP-10, which are anti-inflammatory. So when they increase, it's beneficial. So these are ways of testing the system. Again, this is not a study that was done in rheumatoid patients, that we don't have time to go over that. Some have been done, although not definitive. So this is a way of tricking the blood to pretend that it's inflamed, and we see these immune marker changes. And one other interesting aspect of CBD metabolism, which I didn't have a chance to talk about, was that when you look at rodent studies, mice and rats, etc., if you look in their lymphatic fluid, which is where the cells migrate into lymph nodes, there's a big concentration gradient, so that the amount that's in the blood is one thing, like we were just showing you, but the amount that's in the lymph fluid in the lymphatic system may be 100 times higher. So this may be where the immune cells are being exposed to much higher concentration. So it's a very, we can't measure that directly in people, but it's a fascinating part of the metabolism story, that there is high concentrations in lymphatics.
Okay. Another question related, and I think we have time for one or two more questions. This one is around how fast would patients expect, or should I manage their expectations on the immediate relief of inflammation issues when taking high dosages of this particular CBD?
Yeah, so again, what is considered a high dose, of course, remains to be determined. If you're talking about hundreds of milligrams and you're taking it orally, based on studies that NextEvo has done in healthy volunteers, within an hour to an hour and a half, you're starting to approach peak concentrations. And those concentrations are usually associated with some sort of an analgesic or anti-inflammatory effect. So the expectation would be for somebody who has acute or chronic pain that within a few hours of taking these oral formulations, which, by the way, are better absorbed if they're taken with food or with liquids that contain, like a milkshake or something, that they should have relief within a few hours, which probably is similar to what you would expect if you were to take acutely non-steroidals.
Okay, I'm going to try to squeeze in one last question. So this is a question, and I'm kind of interpreting what it's saying, but I think on that last slide you had shown a bunch of different products in different formats, and there was one that there was a few that had combinations of different ingredients, and one of them looks like it included or combined turmeric with the CBD.
Yeah.
What was the thought process of doing that? How does that work with patients?
Yeah, and obviously you may get additive or synergistic benefits when you combine different compounds which have either overlapping or additive properties. It's well known that turmeric, which the active are curcuminoids, like curcumin, which is the yellow color from saffron, there's many thousands of papers documenting the anti-inflammatory effects of curcuminoids. By the way, curcumin, like CBD, is very poorly bioavailable. So you have to do something to the formulation in order to increase its bioavailability. So this is another example of a widely available, popular herbal supplement, which for the most part is completely unabsorbed because the formulations haven't been optimized. And so by combining these two things in an aqueous formulation, you're more likely to have better absorption and interactions between these two overlapping molecules, which have different but maybe complementary properties.
Okay, great. I think we're about out of time, and we covered most of the questions. I combined a few of them, so hopefully for the audience that helps a lot. I want to thank you again, Dr. Chernoff. I want to thank all the participants we had today. I hope this was informative. I hope that it provided some new insights for your practice. We would love your feedback, so please make sure you go to the chat before logging out, answer 3 questions about your experience today, and claim a complimentary CBD starter kit. And with that, thanks again, Dr. Chernoff. And for everyone, have a great rest of your day.